I now want to go on the control of flu by vaccination and which options we do have here in Europe. I want to start with a short introduction of the influenza situation in pigs in Europe, and also shortly give some points on clinical science, and then we will directly go to the prophylaxis and the summary. From CEVA, we support a passive surveillance in Europe. So in all European countries, veterinarians can send in influenza samples, and we support the diagnostics. And every quarter of the year, we show them updated in our dynamic swine flu map, which is available online, and to give you an overview of the actual circulating subtypes in Europe. And the complexity of flu in Europe is nicely seen on this overview of the last year's survey. And you can see that we have a different strain circulating in Denmark, where we have a dominating pandemic strains, and also H1 avian N2 is dominating. In France, till 2 years ago, we had H1 avian N1 as the most dominant one, and now we have H1 avian N2 predominantly circulating. Since this year, we also find more pandemic strains. And interestingly, in all Northern European countries, we do not find that much H3N2 anymore, but in Spain, it's still regularly found. So you can see it's quite tricky. Each area has its own problems or issues. Going to the clinical science, as Montse showed before, the classical flu, as we all have learned in university, also clinically appears like this. We have an incubation of 1 to 4 days, and the course of disease in a herd, in a smaller herd or in a smaller group, is quite rapid. And we often heard in former times also in some areas that we every now and then have the flu outbreak, and then the whole herd is ill, and then the virus disappears again. And there they could have really severe clinical signs with high fever, and it was a clear clinical picture. So everybody was aware, okay, we do have flu issues here. In 2009, when pandemic strains arrived, the situation changed a little bit. And depending on the flu, on the pandemic strains entering into the herds, we had very severe causes. And it was the first time also that we in challenges were able, or not able, to kill animals, but they died, which normally did not happen in flu challenges. Normally in flu challenges, without secondary infections, you often do not even see any clinical signs. You might have a slight fever curve, but you later on in necropsy might find these lesions here, but normally they would not show up with very severe clinical signs. This in the field mainly is caused later on by secondary infections or other pathogens involved. But with pandemic strains, even in challenge trials, some pigs died. With the endemic course of disease, this is, as Montse also showed before, more going in waves through the herds, and often the clinical signs are not very apparent. But some groups of animals might show cough, and also in the sows you have a sow coughing here and there, but it's not the whole herd infected at the same point of time. The litter quality can be impacted, and often the herds describe an increased return to estrus. And there we directly jump to the next part, to the prophylaxis. From CEVA, we can provide you with 2 vaccines against influenza. On the one hand, we have the Respipoc Flu 3. It has been registered years ago, and this covers the 3 main circulating strains till 2009, the H1 avian N1, the H1 human N2, and the H3 N2, and it covers all those variants, including these hemagglutinins. And since 3 years, we also have the Respiratory flu pan, which is an inactivated pandemic vaccine, including a pandemic strain. And both vaccines are vaccinated in the same protocol. It's 2 vaccinations with an interval of 3 weeks. And the immunity starts 1 week after the second shot. You can vaccinate piglets from 56 days of life. And after the pandemic vaccine, you should revaccinate after 3 months. And if you vaccinate the piglets or the pigs with Respiratory flu 3, after 4 months, the revaccination should be done. I want to have a little bit more focus on the reproductive failure or the reproductive part in the influenza, because we often have the discussion that it is not 100%, let's say, agreed that influenza could really have a long-lasting impact on reproductive performance in herds, as it is very hard to reproduce this in challenges. It has been tried very often, but we have to remember that it's not a primary reproductive failure caused, like with PRRS, caused directly through the virus. It's more a secondary effect due to high fever and the disease itself. We have a very nice publication in cooperation with the University of Munich. Sophie Gumbert collected all these data, and we were able to evaluate 137 farms, including more than 60,000 sows, which were all identified being positive to a pandemic strain, either pandemic H1N1 or pandemic H1N2. And we followed up these herds 6 months before the implementation of the vaccination with Respiratory flu pan, and 6 months after the implementation of the vaccination. And the vaccination was administered twice with an interval of 3 weeks in a mass vaccination protocol, and the revaccination was applied 3 months later. We could see on the overview of all farms that we had a significant increase or increased reproductive performance. So the mean return to estrus rate was reduced from 13.5 to 10.2, and the mean abortion rate could also be improved. So we had a really significant improvement of the reproductive parameters. And this, in the end, led to a 1 piglet more weaned per sow per year in these farms. If you look on the number of weaned piglets, you might say, oh yeah, but we want to have 30 or more, so the farms might not be that good. But these data were evaluated roughly in the period, or these farms were included in the period between 2011 and 2018. So this was a broad period, and in that period of time also the number of piglets was increased tremendously. So these numbers really show the average of weaned piglets per sow per year in that period in Germany. And interestingly, this 1 piglet more weaned per sow per year, what does it mean in my pocket? It was, the data were put into an economic calculator provided by an SIP consultant in Spain. And this 1.3 extra piglets weaned per sow per year paid back 5.1 times the cost of the yearly vaccine treatment of these herds, if you consider 3 vaccinations in the sows and 2 in gills in a mass vaccination protocol. Another topic we often discuss regarding vaccination is the cross-protection of respiratory vaccines against more distinct strains, which can pop up in the field. And this publication, published by a working group in France from ANSES, nicely shows the potential of inactivated vaccines also against distinct strains. And we always have to remember that also for the registration of our vaccines, we already have to show that we are able to protect against distinct strains. So we are not allowed to use the homologous strain for the challenge trials. And we also have to perform several challenges with different strains which are distinct to the vaccine strain already. So to get the registration, this is a must. But here in this study, a very distinct H1 human N2 popped up in France in 2012. And the working group found out that this strain did not show any serological cross-neutralization anymore. So this was a strain of concern, and thus a challenge trial was performed to test if the vaccine still covers this strain. And here you can see the results of the challenge. On the left-hand side here, you see in the first row, this is always one piglet. So in each group, it were 5 piglets challenged. And the group here is the non-vaccinated group with a quite homologous strain. Here is the non-vaccinated group with this very distinct strain. And here on the right-hand side, you can see the vaccinated groups. The darker the square is colored, the more virus was spread at that point of time. And as you can see nicely, it's very black on the left-hand side. So with both viruses, the challenge had worked properly. And what they also found out that the variant strain challenged animals also showed very severe clinical signs. And if you look on the vaccinated animals, there was a huge reduction, significant for both groups, of shedding of these pigs, and also none of these vaccinated groups showed any clinical signs. So in conclusion, we got a significant reduction of nasal shedding in both vaccinated groups, and Respiproc 2.3 was able to protect against both subtypes, and especially against this subtype with a huge antigenic distance to the vaccine strain. Other things to consider when dealing with the influenza vaccination, and this is just, we can see it also a little bit as a summary of what Monse already also told, and now in combination with the vaccination. If we vaccinate our sow herd, the maternity-derived antibodies are only able to really clinically protect piglets, but they will never prevent 100% from infection. Therefore, the suckling piglets can still get infected, and they will not show clinical signs, as Monse told before, and so they are a risk for an endemic flu in your swine herds. And another very interesting publication recently shown from Helen Everett and her group from UK, they challenged animals with a 100% homologous strain to the vaccine strain they used, and they could show that even though the homology was 100%, these animals were still able to infect naive sentinels. Although by testing the shedding was really, really low. So non-vaccinated animals like suckling piglets or nursery pigs or non-vaccinated fatteners or gills can then again serve as an influenza reservoir despite a very well vaccinated sow herd. And if a new strain enters the farm, even well-protected sows will then be able to infect suckling piglets despite showing any clinical sign. And then the suckling piglets again can spread the virus into the nursery. And as mentioned before, also the species barrier between human and pigs has been torn down totally due to the pandemic strains in 2009. And therefore, we could state that minimum vaccination of the sow herds and farm staff working in farms, pig farms, should be mandatory. And even we as vets going on farms should make sure that we are vaccinated. And as Monse showed before, as often the sows at farrowing are positive and then go back into the gestation area, we have to remember that a really good coverage of the sow herd, and this is ideally done by mass vaccination minimum 3 times a year, helps really to have a proper herd immunity in the sows and also helps to stop the circulation of virus in the sow herd. And with gilts, as Monse said before, we would even suggest to try to get vaccinated gilts entering the sow herd, and preferably to starting vaccinating just in the quarantine, because you're often too late if you start vaccinating there. They get infected before they can build up a proper immunity. And a very good statement by Lopez Valinas in 2021 in the conclusion of his publication was that he stated that a real strict vaccination schedule should be carried out on farms to avoid maximum influenza circulation. And this would mean to increase also the current percentage of swine population vaccinated against influenza. He stipulates that 10 to 20% of the animals are vaccinated at the moment. And this is, even if we would vaccinate all sows, we would not reach much more. So we should also think about including the piglets into our vaccination strategies. There, I'm already at my summary. We can say that influenza really plays an important role in the swine production worldwide and is an important part of the PRDC complex. With Respirococcal flu 3 and Respirococcal flu pan in combination, we are able to cover the majority of influenza strains circulating in our swine populations in Europe. And as we have seen, really the vaccination against influenza has a huge impact on the reproductive parameters in influenza-infected sow herds. And as we have seen in combination with the presentation before, a successful strategy against influenza has to be built on 2 pillars. On the one hand, the vaccination, but for sure the management has to also be improved to have the best possibilities in the control of flu in the sow herds.